General Hospital. From the SGU Windrep Lab, a total of 26 new cases of COVID-19, 26 new COVID-19 infections were identified. 13 of these cases were close contacts of family contacts of case number 44, which was one of the cases, the local case that was identified the day before. 3 staff members and 9 guests at a hotel in the south, and 1 guest at another hotel. There were an additional 35 individuals pending testing. Their samples were batched in 7 pools, and these pools were abnormal. So we await the final retesting, the final results of these 35 individuals. At General Hospital Lab, 1 new COVID-19 case was identified. This was a 10-year-old female who traveled to Grenada on 7th of December 2020 from Canada. In addition, there is an additional 10 samples in a pool that are pending retesting because the pool was identified as abnormal. As of today, active case finding continues. Extensive testing is ongoing at present for the 200 plus remaining employees at the hotel, and the results will likely be ready by sometime either later tonight or tomorrow. Testing sites extends to communities and other business places, and this will continue throughout the next few days. So in conclusion, up to Friday of last week, we had 45 confirmed cases. As of yesterday, we have recorded a total of 71 confirmed cases of COVID-19. However, it is very likely that this number will increase significantly once all of the pending results and the additional tests are completed. Thank you.
Charles, we have now been joined by Dr. George Mitchell, a member of the COVID-19 Advisory Committee. Dr. Mitchell, good afternoon.
Hi, Leslie Ann. Pleasant good afternoon to you. Good to see you on a Sunday evening. And a very pleasant good afternoon to your listenership. I reckon that we're being listened to wide all over the world. Is that correct?
Yes.
Okay, so I'm sorry for joining a couple of seconds late, but I just wanted to say that since the discovery of that case at Sanders a couple of days ago, our team has really shifted into the highest gear possible to ensure that what we do is done in the swiftest possible way, and that we leave absolutely no stone unturned in our response to this pandemic. And I want the public to know that. From the onset up to a couple hours ago, we have been meeting. We have spent countless hours. Up to last night, we were up 1, 2 o'clock in the morning when everyone else probably was sleeping. And we resumed again this morning to ensure that we got it right that our strategies, our plans is in accordance to best practice. Let's not forget that since the beginning of the outbreak earlier in this year, we have been guided by sound scientific principles and best practices, and we are not about to deviate from those. Uh, this and those practices have brought us the successes that we have, and we have really no plans indeed to move away or to veer away from those practices that has bring us all these successes. I must say also that in the past few months we have collaborated with our partners as part of our strategies. We've built partnerships, and that has helped us to where we are, and we are going to continue to build those strategic partnerships. We however said, Leslie Ann, that in all of that, as we continue responding to COVID-19, that we wanted to remind folks that breaches may occur, and every speaker, as far as I know, every representative from the Ministry of Health and from the COVID-19 committee continued to advise the population that we need to take the necessary measures to protect ourselves. Every day it came as though we were over preaching the messages, but that was our mantra, because we knew at some point in time that some sort of breach would occur, and that if and when that breach occurred, that our population should have been or should be in a position to protect ourselves. So I cannot but overemphasize that point, that we have been pointing that out to the population, to heed our call, our cry, to do the right things, to wear masks, to take the proper hygienic measures, and to keep the distancing. So here we are facing this rather unprecedented situation, and we're calling again on the public to redouble your efforts to ensure that we get this situation under control as quickly and as swiftly as possible. And measures are going to be taken in that direction. I must say that we have not sort of like let our guards down. I recall just last week, if I'm not incorrect, that a simulation exercise was held at the General Hospital, simulating a case and what do we do in that event. So we have not sat back on our laurels, not preparing. So apart from that, our wardens program is up and running. They have been doing mainly home visits, but they are ready to do contact tracing. And so we believe that we're in a good position to be able to respond to this current situation. So I would rest here and allow for another person. I think his minister is on the call.
Yes, thank you, Dr. Mitchell. So we go now to the Honorable Nicholas Steele. Minister, good afternoon to you.
Thank you very much, and good afternoon to all of our viewers and listeners out there, and our members of the media in particular. Sisters and brothers, we have consistently said that there is a risk, that none of our systems, as strong as they are perfect. There have been breaches in the past, and we have dealt with them. There will be breaches in the future as well, and we will deal with them. We simply cannot close our borders. As a nation, we recognize that we do have to keep our borders open and put as much controls as possible on this to protect our citizens here in Grenada. The issue here is one of the safety of our frontline staff and their family. And that is what the ministry is addressing first and foremost, to identify those who have been put at risk, to identify those who may have or have been infected and to deal with them first and foremost. Parallel to that, there is increased testing and enforcement of the very protocols that exist at our ports of entry and our accommodation facilities, all of our accommodation facilities. We as a nation have done well to date. There has been a significant price that has been paid in the measures and steps we have taken in the past. And many continue to pay this price. As a government, and I have said consistently, we will continue to try and find as best as possible the balance between saving lives and livelihoods, but a balance must be found. On certain occasions, the scales have tipped to one side or the other. And as a government and as a people, we have adjusted accordingly. COVID-19 is not going to give up easily. The battle is not lost, but the battle is not yet won. Now more than ever, we need the full cooperation of all of our Grenadian brothers and sisters, our highest level of diligence, as this is one of our highest threats that we have experienced thus far. We have not just spoken to this possible eventuality, but we have planned and prepared for this eventuality, not just as a government, not just as a Ministry of Health, but each and every one of us out there have contemplated this eventuality. We are now dealing with this situation. All of us would deal with it accordingly, and it deals with communication, cooperation, but most importantly, compliance. We need now more than ever, the full and complete compliance of all of our citizens as we overcome this new hurdle from COVID-19. Thank you.
Thank you very much, Honorable Nicholas Steele. So we go now to the Honorable Emmeline Pear, Minister for Education, Human Resource Development, Religious Affairs and Information. Minister, good afternoon to you.
Good afternoon, Lesbian, and good afternoon to my colleague and team from the Ministry of Health, media houses, representatives who are present, and of course, all those who may have joined from the listening and viewing public. I want to join my colleague in saying that we no doubt face a very serious challenge today. The news that has been shared with us a couple minutes ago by Dr. Sean Charles is no doubt news that is not very encouraging. But I believe that what we do now, Leslie, and what we do as of now, what we do tomorrow, what we do in the coming days, will determine the level of success that we will have in overcoming this challenge. I believe the scripture that says that God has not given us a spirit of fear, but of power, love, and a sound mind is so very relevant today. Therefore, it's not a time for panic. It is not a time for us to speak doom and gloom and to lose hope. But I believe that this is a time for us to renew our faith, a time to renew our faith, but a time to exercise wisdom, to take decisive action. As Dr. Mitchell indicated, for months we have been talking the language of how strange this virus is, how vulnerable we all are, and why it is so important that we are always on the alert. Why it is so important that we always observe the protocols and be ready to respond. And so I want to use this opportunity, Leslie, and on behalf of government, to recognize the hard work, the commitment, the successes of all of our people, and particularly to recognize our frontline workers. If there was ever a time, I think the time is now that they need our support. Our frontline workers need our support, especially at this time. We commend them for their service. They need the time, they need the space to ensure that they take a total grip of the situation. And so, Leslie, and we do not wish that there would be a total lockdown as we have had before, if everyone would cooperate, if everyone would do all that they can to protect themselves and to protect each other. So we are all aware, we all know the protocols. And so this situation calls on us to observe all of the protocols. We do not anticipate either that this situation would have a significant impact on regular church activities for this very special and holy season. But again, I remind us what happens after today will largely be dependent on our preparedness to observe the rules and the protocols to protect ourselves. And so I believe, Leslie, and it's a time that as a nation, we look to God, but we also look to ourselves to make the right decision, the right choices. Many social activities will have to be curtailed during this period, but I believe that our people will understand that at this time, it is important to take total control of the situation. As was indicated before, we have had many successes, and I believe we will again succeed at bringing this situation under control. Thank you.
Thank you very much, Honourable Minister Emmeline Pear. Our media colleagues, you've heard from the Honourable Ministers as well as the Acting Chief Medical Officer, Dr. Sean Charles, and Dr. George Mitchell as well. The floor is now opened for questions, but maybe we can start with Dr. Sean Charles. We've been getting some questions. People are seeking a bit of clarification in terms of the numbers of active cases right now. So, Dr. Charles, we go over to you. Dr. Charles, are you hearing us? Okay, we seem to have lost control.
Oh, sorry, I was muted.
Oh, okay, right, great. So let me just repeat the question for you. They're seeking clarification, the public is seeking clarification as to the number of active cases that we have at this time.
All right, so at present, we have 30 known active cases, but remember I said that that number is likely to increase significantly once we have the final results of all of the testing that is being conducted this weekend.
GBN, good afternoon.
Good evening to everyone. I have 3 questions. My first question, there was a positive case mentioned at a second hotel. Is the other hotel also on lockdown, and will it be identified? My other question, what are the communities of interest for contact tracing and so? And my last question, can it be disclosed whether or not the hotel was guilty of breaching protocols?
Let me address that with answering question 2 first. With respect to communities, we are a small island nation. And in dealing with a pandemic like this, and the fact that we freely move throughout our island, it is the entire tri-island that is on alert right now. We do not think we have the luxury to identify a parish, town, or village in this instance. But let's look at it as Carriacou, Grenada, Carriacou, and Petit Martinique. And that we must step up the level of due diligence. With respect to any breaches or so, there is a full investigation on this as to how and why and when in particular. These questions can only be properly answered when we get the full gravity of the situation, i.e., as Dr. Charles has said, when the testing is complete, when we have the full numbers of testing. And that leads straight into your first question of an individual at another hotel. Because of the answer to question 2, which are the facts, we do not have as yet in any other hotel except one individual. We are going to be testing all. And then we will be able to make a determination as to whether it was that individual traveling around, interacting with, or if it is that there is another facility. It is too early to answer that specifically, but we need to take, and we are taking the necessary precautions.
Julian, what was your third question?
He answered all of my questions. Thank you.
Okay, great. So, colleagues, anybody else with questions?
I have a question. I have a few questions, actually.
Go right ahead, Mikey.
All right, so are we contemplating, or is the government looking into any sort of movement restriction in order to manage the contact tracing and the further spread of the disease?
But let me address that by saying this is something that we have prepared for. The mere fact that you are asking that question, we are asking the public to curtail their activities, to only go out to work and for necessary activities. We believe that as a people, that we have been preparing for this. We are very much aware of the necessary steps that need to be taken. Already the ministry has received calls from multiple establishments, particularly in the hospitality industry or entertainment industry, restaurants and bars, that are voluntarily closing. We do believe that this will continue, and it is our assumption that as a people we will recognize that the COVID-19 threat is real and present with us here in Grenada, and therefore each and every one of us will curtail our individual activities to the maximum. I really would like to avoid the implementation of any legal restrictions, further legal restrictions, because I think as a population, as a people, we will act accordingly. However, if it is necessary, we will. But as a government, we believe that we will place the trust in our people and the acknowledgement that our people have recognized that if and when this day came, that they will take the necessary measurements, and whatever level of non-compliance we may have seen in the past would have been from individuals who may have been saying, well, they don't see the threat to be real and present, and therefore would not heed our request. The general assumption now, I think, Mikey, and for all of us, is that unquestionably now we will recognize that right now the threat is real, the threat is present, and we all know what we need to do. So we are hoping and expecting that will happen. If not, we will not delay in taking the necessary measures.
What is the ask of the general public now that we know that there's a likelihood, because the contact tracing is still ongoing, that there's a likelihood that there are people out there who might be COVID-19 positive and not know? What are we saying to these people? What is the message to these people now, whether it is within their homes, how they operate, or when out in the general public?
A significant factor here is that our schools are coming to place. And we need to take the necessary measures between now and when it is time for our schools to reopen, so that our children can go back to school. What we are asking is for individuals to proceed to necessary activities, work, purchasing of food, banks, etc., but to avoid all social activities, all social gatherings. We are asking restaurants to move to takeout only, no form of entertainment in-house. We are asking bars to close. We are asking individuals, as best as possible, to be home in the evenings, not to socialize. We would like to avoid having to put a curfew on. We believe that our citizens will recognize and comply without having to put those necessary or those types of restrictions in place. My assumption is that individuals will go to work and then go home, stop and buy food or do necessary purchases or transactions and proceed home. If we can maintain this over the next week or two, allowing our health personnel to take the necessary measures to identify, to isolate individuals who have been infected. If in our going abouts we remain 100% compliant in terms of proper wearing of masks, hand sanitizing and maintaining of social distancing, not having mass social activities, then we will get through this. As a government, we need to ensure that this happens. In the first instance, it is our belief and our desire that it happens willingly by the population of the Union.
Thank you, Minister. Mikey, do you have another question?
I'll ask in the next round.
All right, great. Thank you so much. So we have a question here from Callistra Faria. What is the procedure for monitoring and reporting to the Ministry of Health by Sandals and other hotels where guests go directly from customs and immigration to the hotels where the testing process takes place?
All guests that arrive, regardless, go directly from the airport to the hotel. The only individuals that are tested at the airport are individuals that are going into home quarantine. All individuals coming into Grenada are tested before travel. We have recently changed the restriction or the criteria there from a 7-day PCR test to a 72-hour PCR test. Within the hospitality corridor, what we have allowed, as has been allowed in other countries, is that the guests go to the hotel. They are not allowed at all at any point in their stay to leave the hotel and mingle with us. The only time they can leave the hotel is to go back to the airport to leave the country. As such, those individuals and those facilities, which are purely those facilities, we do not test those guests because they are not leaving that hotel to come mingle with us. We do random testing, as we did this week, of guests and frontline workers of those hotels, as we have done with all of our other facilities. But the only individuals that are tested are individuals who are seeking to be released from quarantine to enter the rest of Grenada. If you are not seeking to do so, you are literally treated as an in-transit person. You come in for the duration until your next flight out.
Thank you, Minister. So Linda Straker, good afternoon. When you're through, we'll go to Kelon Bub. Linda, good afternoon.
Good afternoon to you, Liz, and everyone else on this panel. I have quite a number of questions, starting with where the minister would have left off. Is there therefore routine or recurring periodic testing for hotel workers? And with regard to case number 44, which is the local case, the 9 guests who would have tested positive, what date did they arrive in the hotel? And is there a certainty that she would have got it from them so far?
With respect to routine testing, all of our frontline, including our health personnel that are involved in the swabbing of individuals, they're all tested on a random, regular basis. Or at any point where they feel they may have had an incident where they were possibly exposed. We have been that remains. That is what I addressed earlier, that will be increased in terms of the frequency of that, most definitely as a result of this situation. Also, when the guests came in, we have focused our efforts on our Canadian people to identify as quickly as possible the Canadian frontline workers who may have been or who were infected from interaction at this facility or interaction with each other. That has been our primary and only focus over the last 24 hours to 48 hours, and will remain until we are satisfied with the information that we have. With respect to the guests, that Sanders has been given instructions to immediately commence operations and moving their guests off island, diverting all other guests who are coming to Grenada to other facilities or cancelling their trips, so that we can focus purely on our people. That has been a priority. So I do not have an answer to the question on the guests as to when they came in. I have been, and the entire health team has been focusing on the Grenadian people working at that facility as well as their families. That's where our resources and concentrate.
I do have a follow-up. Maybe Dr. Sean could assist. With the locals who are now positive, are you in a position to tell us what is the range of the symptoms? Mild, moderate, severe?
All right. So yes, I'm here. So as far as we are aware, only one of the guests so far, and that is our case number 44, reported symptoms, and they were only mild symptoms that lasted for a brief period of time. With regards to the others, remember we are in the midst of assessing all of these individuals, and once we have completed that assessment, I'll be able to give you a better answer with regards to if someone may have had symptoms that may have been very mild, and they may have neglected it for that reason.
Dr. Charles, just to correct, you said guest, but it was employee. One of the employees is the one that
so let me.
Sorry.
Yes, number 44 is the employee. Yeah, so she would have had my.
The employee, sorry.
Minister
Yes.
and Dr. Sean, there are people who are concerned about the whole idea of the guests coming in and going straight to the hotel and not mingling according to that protocol, but the staff is mingling with these people and going out. Is there any concern, or would there be some sort of new protocol where workers are allowed to stay in?
There have always been concerns with respect to any of our individuals, from airline personnel, airport personnel, health personnel at the airport, individuals who transport persons to any of these facilities, as well as individuals who care for persons at facilities. What is obvious here is that more attention needs to be placed and protocols need to be adjusted. The question was asked earlier with respect to a breach, and I did allude to the answer to your question as well, Linda, in that after we have determined the gravity of the situation here with respect to the number of persons that are infected, we also, at the same time, will be looking at the issues there that would have caused it. But our primary focus right now is to, one, as we have done, divert all individuals coming into that facility, have them as quickly as possible evacuate, move off, while we ascertain our level of exposure and address the situations afterwards.
All right, Linda, that's it for you for the time being?
I'll ask more on the other round, so let's go ahead.
All right. Kellon, Bob, good afternoon.
Yes, good afternoon, Leslie Ann, and good afternoon to the panel. So my first question, Minister, earlier in the press conference, you suggested that you're requiring cooperation from the Grenadian public. What expectation, therefore, do you also expect the hotel and tourism sector to also cooperate with you with respect to ensuring that they are also following the protocols? You also indicated that there would be an investigation on this matter. Could you tell us what the timeline of that investigation would look like, and if there would be any penalties with respect to if we do find out that folks have not been following the COVID protocols at the hotel facilities? The final question, and that has to do with you said the evacuation, folks will be evacuated from that hotel facility. How, moving forward, how are we going to ensure that we have compliance, the same compliance that we expect from the Grenadian public, is the same kind of compliance that should be expected from the hotel sector. How would we ensure that they have compliance there outside of only having site visits? Those are my questions.
Well, with respect to the first part of how long an investigation would take or so, once we get a better sense of the gravity of the situation as to how many people, that will allow us to get a sense as to begin to answer the questions of when and how this happened, and therefore whether it was a breach or a flaw in protocols. And that will determine the length of the investigation and the actions taken. Rest assured that if it was a breach, the necessary actions will be taken. If it is a shortfall in the protocols as well, the necessary actions will be taken. But we are addressing this with an open mind, approaching this with an open mind, focusing first and foremost on our communities and our Grenadian people, stopping the activity or that has been recognized to have had a flaw until we determine what that flaw is, and then we'll address as to whether that activity can start back in any form or fashion, or whether significant changes have to be made for compliance. So the issue of whether it was non-compliance or not, it is early, but we will make that determination based on the information, and we'll take the appropriate action based on our findings. In terms of stepping up on the inspections, and so yes, most definitely. What we have found in general, the majority of our sites have been compliant or have made every reasonable effort to be compliant. We have found that some have not, and those most recently, some of you may have heard of some being removed from our list, others being closed until we were comfortable of their level of compliance. Not just our hotels, but also some of our restaurants, etc. It is to ensure compliance to the measures that we have put in place, which are meant to protect us based on the science as much as possible, following along the lines that we've always had, that we do not believe that any of our systems are perfect. They always need to be revisited, and we always need to maintain the 3 lines of defense.
I have a follow-up, Minister, and that would be my last question, assuming I'm guessing there would be another round. But to your point about compliance, the Grenadian people, when they're not compliant to COVID-19 protocols, are held criminally liable. They can go to court and they would be charged for breaking those COVID protocols. Now, I'm wondering, when you talk about compliance within the context of the hotel sector, are they also going to be held with the same civil liabilities, or what does that look like with respect to ensuring that they're also held accountable?
The law is for everyone, Keller. The law is for everyone. And where the law has, which it does, it has penalties, then we will not hesitate to use those penalties.
Thank you very much, Kellon. I have a quick question here from social media. Does Grenada have a freezer capability for -70 storage of vaccines?
We seem to have moved on, but the short answer to that is no. Not mass storage of. We do have small-scale storage of.
Thank you, Minister. Any change in transportation protocols at this critical period, or will public transportation operate at current capacity?
We believe that the COVID committee, and as was discussed with Cabinet as well, we believe that if we are asking people to curtail their activities and get back home from work as soon as possible, only doing the necessary errands, so to speak, that we do need public transportation working as efficiently and effectively as possible. However, I think it is now more than ever necessary, not just for the government, law enforcement, but most definitely for the Grenadian people who use who use public transportation, to ensure, and for the owners and operators of public transportation, to ensure that they are fully compliant. It is not practical to assume that it is purely the Ministry of Health and the RGPF to ensure that. It is for us as a people to ensure that public transportation and all other aspects, supermarkets, banks, other business establishments, and so that we as a people, not just a government and police and Ministry of Health, insist that the protocols are followed now.
Thank you, Minister. We have another one from social media going forward. What is government's, although I think we touched on it a bit, what is government's policy on social gatherings given the latest COVID-19 situation?
We are asking that all social gatherings cease, that persons stop as much as possible all social gatherings, at least for the next week or two, until we get a firm grasp of the situation and a firm control of this situation. We have seen in the last several hours an outpouring of support and compliance of that, with many promoters and many establishments notifying us of the intention to close immediately or to cancel or postpone their planned activity. We are expecting that that will continue. As you have seen with the release that we made earlier, we have technically revoked all of these permissions, but we are evaluating it. So we haven't done a blanket revocation of all of the permissions, but we have clearly said to the public that it is under evaluation or re-evaluation, and we expect that all promoters would take that to heed and await. We will try as best as possible as get a firmer grasp of the gravity of the situation here, to set new protocols or a new criteria, which may exclude some that were previously given permission up to this weekend, or may exclude all. It all depends on the gravity of the situation. We do not want to take harsh measures initially, but we have seen, and this has been worthy of mention, majority of individuals recognizing the gravity of this situation and taking the steps themselves and not waiting for us to tell them. And I think that is a responsible way to go. And I think the public needs to recognize those promoters who are responsible enough to recognize and take the steps first and foremost, and not wait for the Ministry of Health to tell them to take those necessary steps.
Thank you very much, Honorable Minister Steele. GBN, you have another question?
Yes, my question is, I understand that some sandals workers have been tested and sent home before receiving their test results. If this is so, why are they not in quarantine until their results clear them?
But each situation for an individual is unique. You have some workers who have young kids at home and they are the only ones there, and it's necessary for them to return. You have other individuals who have situations where they live alone and are able to self-isolate. So we had to do it on a case-by-case basis. That is the standard procedure that we've used previously. Anyone who we believe was at risk of infection from an individual is asked to isolate until their results are determined. So whether if they are newly arriving, they would isolate or remain at their facility. If they are in our community, they are asked to isolate or quarantine at their home if it does allow. What we do have to recognize, though, based on numbers, that it is not possible to find a facility for all. We will work with as many people as possible in relocation where it is determined to be high risk or there's an individual in the household at high risk. But in general, what we need is for individuals to as the phrase goes, shelter in place, stay in your home, isolate from the rest of your family. If it is not possible for you to move somewhere, if it is possible, then you do so, but you remain in place and not circulate.
All right, that answered my question. Thank you.
Thank you so much. Mikey, you have a question?
Yes, I have a few questions. Now, would we see some sort of printed or published document outlining what the guidelines are for moving forward so that there's no ambiguity in terms of what the employers are expected to do, what employees are expected to do, what bar owners are expected to do? Because I can see a lot of trouble here if we are not clear on that.
Yes, Mikey, we are preparing that. We felt it necessary to come to the nation first off because, as we're all aware, there was a lot of information or misinformation circulating on social media. And in order to prevent a panic, to come to the nation now with the facts that we have, although we don't have all of the facts, to come to the nation now with the facts that we have. This has been our policy before of always giving the information as we get it. Once it is confirmed, Dr. Charles did allude to that. He's clearly stated the tests that are confirmed and clearly stated those that are pending as well. This was done in an effort to give members of the population the possible gravity of the situation that we are dealing with. But in terms of the procedures that we are asking people to follow, yes, we will circulate that information. But in general, we are asking people to be compliant with what has been circulated in mass. The wearing of masks, hand sanitizing, social distancing. We are now taking that further step, which is what you are asking for with respect to the type of activities that we want people to refrain from. But in short, but it will be put out, in short, work, food, finance, and healthcare. That should be the only things that we venture out for over the next week or two. If we do it efficiently and effectively as a people over the next week, it may not necessitate a following week. If we don't do it properly over the next week or two, it may necessitate more time and stricter measures. But we have faith in our people, and therefore that is why we are first asking for compliance. Over the next 24 hours or so, we will monitor and take the necessary actions.
All right, thanks for that. And based on the data that you have, are you concerned that there might be a case of a community spread here? And for the benefit of those who still are not sure on what community spread means, can you explain that to us?
At this point in time, this is still by classification deemed an import-related case, venturing to what would be referred to as a cluster. Import-related means that you know exactly how it entered the country and infected the other individuals in the country. Cluster means that it is a large amount of individuals or a reasonably large amount, but you are able to source it to a specific, or track it or trace it to a specific source. Community spread means when you are not aware of how the individual got it. You cannot trace them back to a specific incident. So we are not yet at a community spread. We can say that it is in our communities, but we are able to right now, all of the cases we have found to date, we are able to trace them directly back to a source.
And finally, are establishments, hotels allowed to develop their own protocols that may contravene the ministry's protocols in terms of how you operate with your guests and how employees should go about doing their daily duties?
No, they are not allowed to. They can go above, but definitely cannot deviate to create risk or so. No.
That's for you, Mikey?
That's it.
All right, great. Thank you. Callistra, you have other questions? Callistra?
Leslie, and I believe Callistra has another question that she put in the chat. She was actually trying to get your attention, but I would...
Can you guys hear me?
Yes, Callistra, we hear you. Thank you, Kellen.
Thank you, Kellen. My audio is working again. Wonderful. So I was wondering if any other properties, hotel properties, are offering all-inclusive stay, and if are they also being asked to follow the same procedure as Sandals to cease that operation and possibly evacuate the guests? And also, has Sandals actually started the evacuation yet? And if they haven't, have they said to the ministry when they will begin moving the guests off island?
There are three other that have that criteria. They have not been asked to cease as yet. We have started testing there as well, just out of an abundance of caution. The issue here, Callistra, is in asking them to, what would we be asking them to shut down for? What is the issue or the cause? So we are monitoring all of the facilities. I think it will most definitely lead to, over the next 24 hours or so, us questioning the existence of a corridor based on the information that we have. Those questions have been raised already by us as well, and we will make a determination very quickly on that. The one facility, Sandals, has been asked, and that their evacuation procedures or redirecting of their guests has started, yes.
That's it, Callistra? All right. So
Have they given any? Have they given any time frame as to when they will complete the evacuation?
We spoke to them. Actually, it was midnight last night that we had the instructions, and we'll be going back to them at the end of this conference, members of the team, to ascertain as to the timelines involved. But we have told them to start immediately and to bring it to a conclusion as quickly as possible. I will expect a day or two, maybe 3 max, but we will be able to give a report on that based on the feedback we get from them. Just
okay, my final.
Go ahead.
My final question, Minister. At Sandals, based on my investigation, which involves speaking to staff members there, guests and staff walk around without masks. There's a lot of mingling. I've been told of instances where guests and hotel workers were hugging each other. And we have the situation where, as you said, they're not, if they're staying, we're planning to stay in the all-inclusive setting, they are not, they are not tested. Didn't the ministry recognize that you may not be aware of the breaches in protocol, so that's not what I'm asking you about, but didn't the Ministry of Health recognize the risk involved in allowing something like that to happen when members of the Grenadian community are the ones who work in the hotels? I mean, it seemed kind of obvious that risk was there once we were saying people would be able to stay without being tested.
But Callistra, you're pushing the envelope a bit with that statement beforehand. You were saying that guests and staff are circulating in the hotel without masks, etc. You haven't seen it yourself, but you're saying you're questioning. We are saying, and they are saying that is not the case, that the employees are always following the procedures. We have just said that we are investigating that. I think it is not 100% responsible to be making that statement, but it is something that we would be looking to see as well, if there has been any occurrence of that. Not just at Sandals, the wearing of masks has to occur in all of our hospitality facilities. This disease doesn't just recognize the Sandals. It is the same for all, that all hospitality workers are to have the appropriate protective gear and take the necessary protective steps to ensure their safety. So that is not just an issue for a specific establishment or so. It is across the board. So if it is occurring in any of our other facilities, if it is occurring in any of our restaurants, if it is occurring in any of our stores, if it is occurring in any of our schools, it has to be addressed the same way because COVID loves that and will spread on that. With respect to anybody coming into Grenada from any country that is at risk, we have always recognized the risk and clearly stated the risk and said that we have put measures in place. In fact, we have gone above and beyond now in that persons coming from low-risk places are still asked to quarantine as well. So we consistently adjust, recognizing that the risk levels, one, are consistently changing. Two, the science and knowledge of the disease is consistently being updated. And three, learning from any and all incidences or instances, not just here in Grenada, but throughout the world as best as possible.
All right, colleagues, so we're at the 1 hour mark. We're getting ready to wrap things up in a bit, but we have another question here from social media for either the Honorable Minister or Dr. Sean Charles. What are the possible challenges the Ministry of Health foresees, if any, moving forward?
Dr. Charles, you want to take that first, and then I'll...
Yes. So one of the challenges that we foresee is the challenge that we've been dealing with for the past weeks or months, and that is getting the population to take this outbreak seriously, getting them to adhere to the outbreaks, getting them to understand that they should not let their guards down. All right, that is one of the major challenges that we foresee. What we are talking about here is behavior change, and we need persons to understand that this is necessary at this time. Other challenges would include, now we have this cluster, and we have individuals who live in communities. So we must now go to each community where there is a case. We must identify all of the contacts, whether it's family or otherwise. We must quarantine these individuals. We must test them to verify whether they were infected. And if we do find other cases, the whole process starts over. It is a labor-intensive process. Our health team has been battling COVID from its inception, and it's not getting easier. It's not getting easier. So the main challenge that we are embarking on, and I know that members of the health team, some of them are tuned in. The main challenge with the process of control itself is another huge task, but it is a task that we will embark on. It's a task that we have done before. It's a task that we are confident that we can take on, and we can get this under control. But in addition, one thing that I would like to point out, we really need the cooperation of everyone out there, but in particular, in this festive time as we know it, we need the cooperation of the public, and we need the cooperation of all of the individuals who have embarked on organizing multiple social events. We need their cooperation, and we need their understanding. The epidemiological situation in the country has suddenly changed. This is not something that we have asked for, but it's something that we must respond to. And we would like to ask these individuals to be responsible. Many of these activities, if not all, are potential super spreader events. They must reconsider. This should not be something that is legislated. We want everyone to be responsible and assist us. the health team is calling for everyone to assist us to get ahead of this issue. And the only way we can get ahead of it is with the assistance of everyone else. Thank you.
Dr. Charles?
Yes, I think, Dr. Charles, you've summed it up nicely. The situation in Grenada has changed. Last week and in the previous weeks, we have had multiple discussions with many individuals with requests for certain leeway, allowances, or pushing of the envelope. We have tried as best as possible to accommodate that, to find that balance. Because the situation has changed, that balance must be readjusted, drastically readjusted. The challenges for the ministry are primarily right now logistical. To identify individuals who have been exposed or interacted with individuals who have been exposed, to isolate and test those individuals. If mass gathering activities of any form continue, think of the possibility that we have identified someone immediately after they have attended a mass gathering activity, that it makes the task of the Ministry of Health so much harder now, because we have got to go and identify all of the individuals who were at that activity and ask them as well to isolate until we are able to make a determination of the level of exposure, if any. So we seriously need to take this into consideration based on the numbers of cases that we have just identified. It is safer for individuals to assume now more than ever, or necessary for individuals to assume now more than ever, than in any aspect of our daily lives interacting with fellow citizens, that there's a possibility that you or the individual that you are interacting with could be exposed. We now need to take it seriously, practice those social distances, so that the challenge of the ministry identifying and isolating does not keep increasing exponentially. Every single event poses an exponential risk for us to get compliance from everyone involved, to make sure that when you leave the confines and safety of your home, you take the necessary measures to mask for yourself and those at your home, to practice hand sanitizing, to keep your physical distance, and only be involved in necessary activities.
Thank you so much. So we're getting ready to wrap up. Linda, I understand that you have a final question, and then we'll wrap things up.
Leslie and I had indicated in the chat that I had one quick question, please. Can you indulge me?
All right, Calista, go ahead quickly. We're getting ready to wrap up. Go ahead.
Okay, Dr. Charles, I've been trying to get you for several days on this matter. Even while we were grappling with dengue and COVID-19, there appears to be a new health challenge emerging with the Culex mosquito. The Ministry of Health currently interviewing patients who were hospitalized and put in a database that there's a Culex situation developing that's related to the Nawasa sewer treatment facility at the Mount Gay housing scheme. Can you speak to that, please?
If I intervene here, to the clear and present threat that we're dealing with now of COVID-19 and the cases. I am sure Dr. Charles will make himself available once he does have time later on in this week to address any other questions that you have. And also, again, you are making statements that are not factual, but...
Minister, I have to interrupt you here. I'm not making statements. No, what I'm speaking about is saying that doctor, saying that...
Let us keep this, while it is a
saying that doctor
that you have
to me later on is totally fine, but you cannot accuse...
Okay,
that are not factual, and Dr. please take my calls and stop ignoring them.
Okay, Callistra, this is for another forum. Please, let us just stick to what we're dealing with right now, and let us just have some respect for the people, please. Minister Steele was making a point. Can we just let him finish, please? Thank you.
The issue at hand, clearly, is our clear and present threat, which is COVID-19 and the cases and level of exposure that possibly exists to the nation, and in protecting the nation as best as possible, as quickly as possible, from this threat. And the issue of mosquitoes related to a specific sewer system or so is what I'm drawing there. Not that it isn't a public health issue that you should also get information on and share. Simply put, one online here right now, as far as I'm aware, is here to get in as much information as possible on this clear threat of COVID-19 so that they can make the necessary adjustments and inform their friends and family. And let us be responsible and keep it to that so that we can achieve the primary goal here of this press conference.
Very much, Minister. Linda, I understand that you have a final question, then we're wrapping up after that. Go ahead quickly.
Good afternoon. Yes, Les. Well, actually, it was a follow-up I had. And Dr. Sean, normally we will be told the age of the persons who are infected. Can you share with us the age range? You did mention a 10-year-old. So what is the age range of this batch of first 30? As well as we have two sites, SGU and the General Hospital, for testing. How have the lot assigned? Because in the eyes of some people, the batch that went to St. George's University seems to have more confirmation, while the ones that went to the General Hospital seems to have less. How are testing kits assigned to the both institutions? Is there a format, or the closest one you get it? And as for to the Minister for Education, school did, I think, had final assembly and class fete on Friday. The minister and Dr. Sean, they're asking people to please stay at home and try abiding for 1 week. What is your message to students who are now on Christmas break? And Minister, my final question to you. During the last parliamentary sitting, the lower house did approve for increasing the fine under the Quarantine Act. However, the Public Health Act makes a fine for just $500. Would Grenada be considering having some amendment to the Public Health Act for persons who would have violated? Because under the public health regulation, which apparently the breaches seems to occurring, are we going to see some legal amendments being done? Thank you. That was my follow-up.
All right. So, with regards to the question of the age range, that will be provided subsequently. As you would imagine, it's a large number of individuals. So we would announce that at a later date. But as you can imagine, these are hotel workers. They generally tend to be young adults, and of course, the individuals that are the contacts that are discovered in the communities. They can be of all age groups, from school age to the elderly. So that information will be provided subsequently. With regards to the assignment of the samples, it's purely random. Some go to one lab, some go to the other. When you are testing such a large number of individuals, you don't stop and individually pick out which samples go where and which samples go where. And it has to do with the time of day as well. The samples that went to SGU are those that were collected in the morning. So it covered the shift that was overnight and the shift that entered in the morning. And those that went to General Hospital were those later on in the day. So it captured different shifts. So that would have explained some of the variances that you see. Because incidentally, the samples that had a lot of the positives. The individual worked that same shift, so that may explain some of the findings. But it's entirely random. That we do not select what goes where.
All right, colleagues, thank you so very much. So we just have our wrap-up comments.
Minister Pear has a question, I think, and then I have a question to address.
Okay, great. Go ahead.
All right. So, Linda, I would say that, when you listen to the reports, you recognize that this virus does not respect age. And so all of the protocols that apply to adults, they do apply to children as well. The wearing of the mask, the physical distancing. And so in my capacity, I would want to appeal to all of our students to be responsible and to follow all of the protocols, to remain home as far as it's possible, and to observe the protocols. But more so, I want to appeal to our adults to really set an example that our children can follow. I think we have dropped the ball in a lot of cases as adults with the message that we send to our children. And I think it's a good point to step back a little and to set a better example so that our students, our children, can follow our example, our lead, our model in terms of how we protect ourselves and how do we protect others in this situation.
And with respect to the fines and Public Health Act specifically as well as Linda, remember that came up, or your question came up, because we went to the lower house to give more teeth to the enforcement of the Quarantine Act. We wouldn't hesitate to do so as well with the public health. However, I am a firm believer that the level of compliance that we will see now from our population will be much, much higher. And that it is not, the only route is not just increasing the fines. It is with public education, it is with us being our neighbors' keepers, it is with us being a community casting a watchful eye and speaking to our neighbors and those in our community when we see them conducting activities that are not acceptable or that are public health risk. That should be the first step, and that should be the acceptable step, as opposed to us contemplating larger fines or so, because I rarely would prefer not going down that route. An example here right now, Grenada still remains an extremely safe country with respect to murder. We do have still the death penalty on our book, but we don't practice it. So I do not believe that the solution simply is for the government or the Ministry of Health or the Minister of Health to increase the fines. If we continue to accept that that's the only solution to us fighting COVID-19, I do not think we will successfully fight COVID-19. We need to ensure as a community, each and every one of us is exposed to this disease when someone is non-compliant. And it cannot just be left to law enforcement and the Ministry of Health. If we increase the fines, the fines still have to be administered, or the offense still has to be witnessed and charged by a law enforcement officer or public health officer. We do not have that many eyes and ears around with respect to police and public health officers. We have to be our own eyes and ears and ensure that whatever activities put us at risk, that we report them, and also these activities that will be conducted by our own friends and family and neighbors, and we speak to our community on it. It has to be all of us in this together. It cannot just simply be public health laws and fines and public health officers and RGPF to protect us.
So it's time for closing statements. So Dr. George Mitchell, we'll start with you, and then we'll go to Dr. Sean Charles, then the Honorable Nicholas Steele, and we will end with the Honorable Emmeline Pear. Dr. Mitchell?
Yes, thank you very much. I sat here and I admired the way that Minister Steele, CMO Charles, and Minister Pay, of course, articulated our response. I think that if we were to get any level of compliance to the mantra that is being preached, that we will be in a safe place in combating this current episode. I want to say that it is an unprecedented situation that we are faced with, but we have the infrastructure. We've been building it to confront this. We must contemplate every single means to get this under control. I just want to say that in every country that has had a serious situation like this, measures to control it has had to be taken. And so the ask of our population, if it's not heeded, then as Minister Steele said, we will have no choice but to have to go a step further to ensure that our responsibility of protecting the country and protecting our people is kept too. Again, I just wanted to reiterate that the only way we can get back to some sense of normalcy is if we comply to the measures that we are being asked to take. That's the only way we will get. I know Christmas is around the corner and many persons want to have a normal Christmas, but without us getting this situation under control, it is impossible. Before I go, I want to take my hats off to the healthcare workers who've been on the front line for months on end. I don't know how they do it. I want to salute the folks at the health desk, which is called the engine room. Those are the folks who ensure that persons who come in are checked and they are exited from quarantine, and they've been doing a fantastic job. I want to congratulate the ones as well who've come on stream lately for making this whole response what it has been. And finally, the public who's been at our side, I call on them again to be part and parcel of this response, because without you, Grenada would never be where it is right now. Thank you.
Thank you, Dr. Mitchell. Dr. Charles?
Right. So I would just like to tell the public that it's not business as usual. Our status has changed, and it has done so dramatically. We should recall that it took us about 9 months or so to get to around 30 cases. And in one day, we have doubled that. It is going to get worse before it gets better. So we should be prepared. No one should be going about their daily lives tomorrow and doing the same things that they have been doing, especially if they have not been adhering appropriately to the measures that will prevent the spread of this disease. It's not business as usual. Persons need to wear their masks. We should not be chasing after persons tomorrow as of tomorrow to wear their masks. We should not be allowing persons to enter our businesses and coming in close proximity without wearing a mask. They need to sanitize. They need to maintain the appropriate distancing. It's not business as usual. We should not be arguing to have someone put on a mask on a bus, because that one might be the person that is spreading it. The public has to become intolerant to this kind of disobedience that we've been seeing. And we each have to be our brother's keeper. The health team, we have been doing a reasonably good job so far in keeping the public safe. I have full confidence that we are going to get this cluster, get this under control. How long it takes for us to achieve that and how difficult it is will depend on whether persons are cooperating and are listening to us and are adhering to the measures that we are outlining. We need everyone's help to get over this one. We need everyone to take personal responsibility. All right, it's not business as usual. Thank you.
Thank you, Dr. Charles. Honorable Nicholas Steele.
Yes, thank you, Leslie Ann. In this instance, let me acknowledge the work being done by our frontline team, our contact tracers, our public health nurses, community nurses, those who, our RGPF, who are going to be called upon with extra measures now, those at our labs, but to our public as well. Information is what is most important. We came to you today with the facts that we have to date. We will be, over the next couple of hours and days and weeks, sharing information with you. Let us share real information. Let us share official information. Please help with reposting the official releases from the Ministry of Health. We will consistently give you updates on the number of cases that have been identified to date. And as we proceed with this, we'll be giving you regular daily updates on the number of cases that we identify as we proceed. The measures that we must take, the significant measures that we must take, let me be frank with you, must continue until the level of new cases either comes to a complete zero or comes to a manageable amount where we know where these new cases are showing up, i.e. with persons already in isolation or so. We cannot expect any easement on the restrictions that we are asking you to comply with, to take, until we have gotten to that point. This is why it's absolutely necessary that we will share this information with you so you can make a determination yourself as to the gravity of this situation. This is the most significant threat that we have had with respect to COVID-19 since the start, or since the discovery of COVID-19. There may be greater threats as we proceed. This threat is the greatest threat we have had. For us to get past this, there needs to be compliance with the measures that we have taken. I think it is the responsible thing for each and every one of us to do right now is to make sure that the activities that we conduct in public are only the absolute necessary activities. We go to work, we come back home. If we need to stop and get food, we do so. We do not socialize, we do not spend any unnecessary time outdoors, and most definitely, we avoid all public gatherings. If we are going to church, it is the spirit of Advent, it is the season of Advent, we make sure and we maintain the 6-foot distance, wear our masks, practice hand sanitizing throughout. If we are getting onto public transportation, I think it is imperative that we ensure that the transport that we are getting on has everyone being compliant. If not, we'll wait for the next transport. We need to make sure throughout that we are kept safe. And to do that, we need to make sure that those around us are taking the necessary steps to keep us safe. Thank you.
Minister Steele, Honorable Emmeline Pierre.
Thank you, Leslie. And with the final words, I would just say, one, we want to remember that we have been fighting COVID-19 since the first quarter of this year. The government of Grenada has invested millions of dollars in this fight thus far. government has lost significant revenues during this period. Revenues that was so very critical to meet many of government's commitments, many of government's obligations, and we continue to strive and to struggle during this period together. We, of course, as was indicated before, continue to recognize the sacrifices of our frontline workers and the cooperation of our people thus far, which I believe is significantly responsible for the successes that we have had. Despite the challenges, Leslie, and we continue to be very optimistic that together we can win the war against COVID-19. It's a season of love, season of faith and hope, and it's a season for us all to just do the best that we can, making our contribution towards this fight. We cannot and we must not sacrifice all of the gains, all of the investments that we've made over the past couple months for a few days of pleasure. And so I want to make this general appeal to all concerned, to give your full support to all of those involved directly and indirectly in this fight. In closing, Leslie, and I want to just also alert the nation and to recognize the strong leadership of our Prime Minister in all of this, and to say that Prime Minister was originally due to address the nation on Wednesday. Prime Minister has indicated his willingness and his desire to address the nation even sooner, based on the current situation. And so all efforts are being made between Monday and Tuesday. And of course, an official announcement would be made to have the Prime Minister address the nation in this very difficult time. Prime Minister sends his best regards, his best wishes, and encourages everyone to be responsible in this very difficult times. And I would just end by saying there's probably two P's that are so very relevant right now. We continue to pray, we continue to protect ourselves and protect others.
Thank you very much, Honorable Emmeline Pear, Honorable Nicholas Steele, Dr. Sean Charles, and Dr. George Mitchell. And of course, to all of you who joined us on Channel 22, our Facebook and YouTube pages, and our colleagues who joined us via Zoom and on social media. Thank you so much, each and every one of you, for being with us. As they all said, we have to be responsible for ourselves. We know the capacity of our general hospital, so we need to do what we have to protect ourselves. As much as we might want to celebrate during this festive season, we still need to be responsible. People lead by example, and of course, the younger ones will follow. I'm Leslie Ann Johnson. Thank you so much for viewing.